Difficult to follow that, really. You've had the science. You won't get anything like as much science from me. I'm a social worker by background. I first became involved in this when I was the mental health director with Welsh Government, and had a real interest, had worked in public health and had a real interest in looking at all aspects of dementia, but came across the evidence around the potential to reduce dementia risk reduction and was quite staggered at how little airtime it had had. And we had a colleague working in Welsh Government at the time, and she and I stole, with their permission, a document from Scotland that talked about a healthy lifestyle and the potential impact that could have on reducing dementia risk. And we published that. We published that document, and that led us to become involved ultimately in what became known as the Blackfriars Group, that looked at the meta-analysis of international studies into dementia risk reduction, and was trying to really push that agenda on a UK level. And one of the things that I came across among those studies, and then we found Peter's work in relation to what had been happening here in Wales, and the Phillip cohort study, which really amplified that and brought it very much to the fore in a Welsh context. But I come with a few things I'd like to look at. So firstly, what do we mean by risk reduction? And Peter's covered a lot of that, so I won't labour that point. Why should dementia risk reduction be a priority for Wales? I think, again, much of that has been covered, but I'd like to reinforce some of those messages. For whom should it be a priority, which I think is a critical point? What has been done to date, and what are the levers for promoting risk reduction, and how can we help people to reduce their risk? And Peter's given us the messages, but it's how do we translate that into scale and pace in Wales? Because we know the science is there. And I've been frustrated because one of the things when I've gone on a platform and talked about this, two things I've noticed actually. One is when I've spoken on a platform about this and been addressing the public health benefits of looking at dementia risk reduction, I've been challenged on the evidence. And people have said, well, where's the evidence for this? And although there is growing evidence and the evidence is becoming more and more embedded, there is still this challenge around, do we really know that that's the case? How can we be sure that the evidence really stacks up? And for me, the frustration has been, well, the evidence is there. The evidence is not counter to lifestyle approaches that we would take on cancer and heart disease and diabetes, the things that Peter's been talking about. They are exactly the same messaging. So why would we not add the potential for dementia risk reduction into those public health messages and into those public messages that we address? Because if it is going to promote a change in behavior, and if it will promote better public health, why would we not use those messages? And actually, when I went to a UK meeting and we were discussing these things, there was one person who said, why are you wanting to confuse the messages we're sending to the public about lifestyle by introducing dementia when we have clear messages for cancer and for cardiac? And I was a bit taken aback by the question for a start, because I thought, well, if actually we're putting that information in the public domain, that would be a positive thing. So why ask the question? But the second thing was, do you not understand how people are concerned about dementia? Every one of us has loved someone with dementia and watched them go through the process of having dementia, whether it's a family member or a friend or a neighbour. We've all participated in the disease progression. And if we are telling people that you can reduce your risk, why would you not want that? In fact, I think there's a duty on us to put that information into the public domain to make sure that people understand that there are things that can be done about this. This is not an inevitable process of aging, and this is not a cause of aging. This is a different process, and we need, although age is one of the biggest risks, the fact that we are living longer makes this a much bigger public health issue. And all of those factors should be making us shout from the rooftops about this. And I think it's interesting that 400 people turned up here to hear your messaging when it was on a broader platform. This event was put out with regards to risk reduction, and we had a low uptake. And I think there's something in that in terms of how much are people really attending to this issue in terms of the potential of reducing the prevalence of dementia and the human impact on individuals, on families, on communities as we go forward. So I must admit I'm a hobby horse. This is not my day job. This is me coming back to an issue back into a public health arena. I work in a different part of the NHS now, but I feel so passionately about this in terms of the duty we have to make these messages clear and to reach a tipping point where we're beginning to talk about this in the same way that we talk about other aspects. So what do we mean by risk reduction? It's not necessarily prevention. This is not a silver bullet. It cannot guarantee that you will, if you follow these lifestyles, it cannot guarantee that you will prevent the potential for dementia. It's definitely not about blaming people. It's about ensuring that people understand and have the information they need to make choices. And risk reduction may involve the potential to prevent, but also those other important things about the potential to delay the onset of the disease, and for those people who have a dementia who can still make lifestyle changes to slow the progress of the disease. So at all stages, this messaging is critically important. And one of the things that frustrates me when we want to talk about dementia and when we want to engage the public around issues in relation to dementia, what always is used in the publicity materials are pictures of people like me and older people than me. And actually, this is an agenda that we have to speak about, really in terms of the general lifestyle issues from childhood, but certainly for people in their 30s, their 40s, and their 50s, this messaging is critical then, because those lifestyle impacts that you make then are likely to impact on what your long-term future will be and reducing that risk. And what really worries me about the potential of some of the messaging is some people may read the messaging around cancer risk, cardiac risk as, well, live fast, die young. I can behave in these ways, and that means I will shorten my life, and therefore I may reduce the risk of getting a dementia. The reality is that we will live longer. More of us are living longer. Not all of us are living longer, as the BBC would often have us believe. More of us are living longer. And we will live longer, but possibly with poorer health. And if we don't address the messages that we hear about public health, the potential is we will be more likely to have a dementia. So the live fast, die young attitude is not one which will actually guarantee that you dodge the bullet of developing a dementia. So this messaging is critically important throughout the life course in terms of the impact that lifestyle can have on dementia and the reduction of risk. So why should it be a priority? Well, the one that is clear and obvious to any of us that has known somebody with a dementia is the human cost, the impact it has on that person, their quality of life, their relationships, the impact it has on their family in terms of the caring responsibilities that person have, the sense of loss for the individual and for their family members and for members of their community. And of course, there are issues in terms of premature mortality and those issues in terms of the loss of the person before that earlier mortality. And I think one of the other things that's really important is there is real public concern about dementia. People are fearful of dementia. They know the impact it can have. It is devastating, and I think some of the messaging we've had from colleagues in Alzheimer's Society and others, which is actually living well with dementia, is a really important message to get across as well. But these are critical messages, and they actually work together. So why should it be a priority? Well, we know the human cost, but there are also societal, service, and exchequer factors. I work in the NHS in performance management, and I'm seeing the impact of our ageing population in terms of additional strain on the NHS. And a lot of that is from other long-term conditions, but actually one of the things that is potentially the deal breaker are the comorbidities of dementia with other physical health conditions in terms of the pressure it places on the system. And I'm also, as a background in social work, very conscious of the social care costs that come with dementia in terms of helping people to retain their homes and to live independent lives. Huge costs for individuals, huge costs for families, and huge costs in all of these areas in terms of welfare costs and the broader costs to the NHS in terms of meeting these needs. So we really have to grasp the necessity to get this messaging out there if we are going to get ahead of the curve in terms of the demands on the system. So the numbers, we know that about 850,000 people in the UK, there's a possibility these data are slightly out of date, and 45,000 of those people live in Wales. The impact of dementia is much greater, though, with 25 million of the UK population having a close friend or family member affected. And it's very positive that we now are seeing the evidence coming through. This is from Rebecca Wood, the CEO in Alzheimer's Research, that the improvements in healthcare and other conditions could be helping to stem the tide of dementia in developing nations. But the rising trends in obesity and diabetes could set back this progress in the coming years. We've heard the messages that we're seeing reduction in prevalence in relation to dementia. When we saw the Dementia UK study, and you'll remember those graphs that showed increasing prevalence, they are not quite as great as had been predicted, but there is a risk that that can change with obesity levels coming through, impacting on the progress that's been made. So what have we achieved to date in terms of putting this message out and making this a priority? Well, we've heard already about the research that's been undertaken, and there are a lot of studies out there that identify the fact that you can reduce the risk of dementia by making certain lifestyle changes. We've had some policy developments, and here in Wales we have Together for Mental Health, which is not a mental illness strategy but a mental health strategy, and talks very much about well-being and how we should be promoting positive well-being and preventing mental health problems wherever we can, and is an age-inclusive strategy. We've had policy in Wales in relation to dementia, and there is policy under development currently on dementia, which I'm anticipating will include issues in relation to dementia risk reduction. We have some public-facing materials. Now, this is a piece of work that I was involved in, and Tony was involved in this as well a few years ago, which was work that we did with Wales Mental Health Primary Care Network. What we realised was that if we wanted to improve the way in which dementia was managed in primary care, people needed to have good information around different aspects of diagnosis, management of dementia. But we decided that we would include a component part in those materials on dementia risk reduction with some clear messaging for GPs around what the evidence was showing. And so we talked about the advice that should be given, and it reinforces much of that which Peter was saying earlier about physical activity, about staying cognitively active, about staying socially active, alcohol use, etc. There were a few additional things for general practice, though, that we pointed out, which is about identifying and treating hypertension in middle age, about identifying and treating depression with a particular focus on dementia prevention and late-stage depression, about managing cholesterol levels, identifying and treating diabetes, and considering things like vitamin supplements, statins, and HRT in women. The evidence was less strong on the last of those, but clearly there are issues about public health messaging being given via GPs to their patients on lifestyle, but also there were observations, tests, checks, and management that could improve and reduce dementia risk reduction. The other thing that we did was some public-facing information. So working with Welsh Government, Change for Life was a programme, Public Health Wales and Welsh Government working together to put some public-facing information out on a variety of areas about changing lifestyle. And one of the ones that we included was around dementia risk reduction with the 6 lifestyle changes that could be made. But I think, sadly, in the 4 years since Peter was doing that work, and at the time that we were doing this work on Change for Life, we haven't seen the uptake that we would wish. And I think one of the things that's really positive is that here in Wales we now have 3 pieces of legislation that may help us to get closer to that tipping point where these messages start to get some traction, start to get into the public awareness. And I think it's really interesting because Peter was talking about the desire for a silver bullet, and the one newspaper that brings a smile to my face when I frequently see it is the number of times I've seen on the Daily Express over the last 10 years or so the announcement of the miracle cure for dementia, and I just have a slight chuckle and think, well, maybe one day, but I'm not sure today is the day. But never have I seen anything at that level talking about the messaging around the potential for risk reduction and the fact that we should be acting now. We have now 3 pieces of legislation. The Wellbeing of Future Generations Act 2015, which is requiring public organisations to be looking to the long term, to be horizon scanning and thinking about what will the actions being taken forward by public organisations today have an impact on future generations. And this is absolutely where this debate needs to be. What should we be doing now to promote understanding, awareness, and give people the information they need and enable and support them to make lifestyle changes that will impact on this critically important agenda. This is a global issue of incredible proportion in terms of the impact on individuals, families, communities, and the exchequer. We have the Social Services and Wellbeing Act with duties now around the prevention and early intervention, increasing preventive services within the community to minimize the escalation of critical need, but also well-being to supporting people to achieve their own well-being and measuring the success and care and support. The biggest tragedy, I think, is that when these pieces of legislation have been coming through and a lot of the developments have been occurring, we have seen austerity measures which have been paring back on a lot of the very services that can promote and enable these things in terms of access to open spaces, leisure, education. Many of the things that we know are not in the control and in the gift of the NHS but can impact favourably on health are sadly being challenged all the time by the austerity measures that we have been living with for a number of years now. And finally, we have the Public Health Wales Act. It focuses on a few key areas. One of them very much is smoking, but they are requiring obesity plans to be put in place to tackle just the issue that Peter was talking about for all of the health areas. And it also places a requirement to look at health impact assessments that are developed by those organisations. So the question is, we are a select group. We have to take, using the jargon around reaching a tipping point, those sticky messages and make sure that we take much of what Peter was saying, the science behind this, and those fairly, because the reality is the science feels quite complex, but the messages are very simple. And that's where people like me, I think, can help in terms of taking those messages out from people like Peter and Tony and trying to push on how we get these messages into the public arena and can impact on translating the science into public policy and the behaviours that we try to change in terms of society as a whole. Thank you very much.